What we've got here is failure to communicate.
From sunny Southern California, we bring you Meet Bridget, a podcast for building confident communication and female badassery. We spotlight women who have bridged the gaps in their lives by building strong relationships and speaking their teenage dreams into reality.
So prevention is the cure. Always thinking about your cells and thinking about your body and treating it well, saying thank you and not abusing it.
Welcome back to Meet Bridget. Today's episode is another incredible interview episode. Today, we're so excited to have Dr. Holly Lucille on the podcast. Dr. Holly Lucille, ND, RN, is a nationally recognized and licensed naturopathic doctor, educator, natural products consultant, and television and radio host. She's also the author of several books, and as an acclaimed expert in the field of integrative medicine, Dr. Lucille has made appearances on many notable national media programs and networks such as ABC, NBC, CBS, Fox, Dr.Oz, The Doctors, Lifetime, and the Discovery Health Channel. She is regularly quoted as an expert in both consumer and peer journals and is now the host of Mindful Medicine, a podcast on Radio MD and iTunes.
She believes in the science, art, and mystery of healing and has a heartfelt passion for the individual wellness of all people. Built on this foundational belief, she uses the magnificence of multiple media platforms to truly make a difference and empower people to be their own primary care providers and heal. She currently practices at a private concierge integrative clinic in Los Angeles, where she focuses on comprehensive naturopathic medicine and individualized care following the rigor of science, the power of nature, and the essence of care. And I personally have had the gift and the honor of working with Dr. Lucille and building a wonderful, deep, beautiful friendship with her. And we are so looking forward to sharing her lion heart and unparalleled expertise with all of you today. Without further ado, meet Dr. Holly Lucille.
Woo-hoo. Thank you for that. Thanks for having me. I'm so happy to be here.
We are so excited to have you. Let's take it away. How was your day today?
It was good. It was good. I think after a long week, it was after a long weekend and sort of getting back into, sort of obligations and such. It's a little chunky at first. And you're like, is it Tuesday? Is it Monday? Is it Wednesday? Is it Thursday? Is it the weekend again here almost? Like, please, please, please let it be.
Feel ya. So what we love to share with our listeners are the formative experiences. And usually that starts with childhood, but we really are so interested in the teen years and formative experiences that create the framework for who you are. So I know and love you and know a little bit about your childhood and your background, but please share with our listeners who Dr. Holly Lucille is.
Yeah, sure. I mean, sharing, I think, is really important. And I appreciate the opportunity to do so. It's funny because you'd think with the lifestyle that I was brought up in, white, middle class, upper middle class, I would say, provided for tons of stuff. I struggled. I did because I was the middle of three girls. My mom and dad actually told me that they had me because my older sister needed a playmate. And it's kind of how that went down a bit. My parents, as lovely as they were, both of them have passed. I feel like they kind of had children and went on with their lives. And from what I know now as an adult person, didn't have the curiosity or the attention or the parental skills to care for a kid, like a small independent, or not independent, excuse me, I should say very dependent person. And I think it rocked my sisters and my world a bit, and of course you don't feel those things until you're later on in life because you don't know what normal is. Normal is what you're experiencing. It's like, there's until you get into there's more stimulus in your life and relationships and opportunities and obligations and jobs and schools and stuff. It's like where you're like, what is, I'll quote, it's like, I wanted to say what was wrong with me, but Oprah wrote a book with I forget his name, but it's like, that's the wrong question. You should say, what happened to you, right? Not what's wrong with you, what happened to you? Really super important question. And not that anything happened to me, but it's like, I think those formative years, as you talk about, are super important. And I think I was just truly neglected. I was a kid with a tremendous amount of talent, athletically, musically. And I just didn't have parents that paid attention to that, or was like, let's get you, like, when I found out, like, 20, 30 years later, where at Berkeley, like, you go to school for music, I was like, wait, what? You could do what? Like, there was like, I was just like, you can do that. I mean, it was incredible to me. And so that, I think, was really something that formed my life. I started to, I lived in the Midwest, and I started to have crushes on my school friends. So and the only thing that I knew about being gay at that time was, I thought, literally, and this is a true story, that I needed to drive a diesel truck and wear a wallet with a chain. Like, I was as homophobic as you could get. I didn't understand. I didn't have any knowledge about it, but I knew my feelings, right? Like, and so that created another dissonance for my developmental stumbling and growth and all of that. So in a nutshell, besides, being quite provided for and such, that shaped basically who I am today. Those little things, those formative years, those were a couple things. My parents just started being checked out, and as a middle child, and then I kind of became their caretaker. I mean, at a very young age, I was the one that was very concerned about them and their health, and that burden on me was sought through out until they both passed. Like, I mean, I hate to say it, but when my mom and dad passed, there was, of course, a lot of grief and sorrow about it. For me, there was a lot of relief. There was not the terrors every day, every night about what was going to happen to them because of their own neglectful behavior to themselves. And so, sorry, that was a long answer, but
I have so many questions. What's the age difference with your sisters?
yeah, so my older sister is just 18 months older than I am.
Okay.
And then my younger sister is 4 years younger than I.
Okay.
So no, Jody was 18 months older, yes, and Heidi is 4 years younger.
Okay. And what were your parents doing? You mentioned they just kind of like went back to work. What professions were they in?
So they were both pharmacists. My dad climbed the corporate ladder of the Upjohn Company, which is one of the, I think, largest pharmaceutical companies at the time, certainly bought out by Pfizer or something else now. And then my mom worked as a registered pharmacist, and she loved it. She loved her people, her patients. It's like, I think that she found herself and her life there, caring for these underserved people. She'd work in the impoverished areas of wherever we lived, because we moved around quite a bit because of my dad's career. But she loved it. And I think it was also, to be honest with you, to be completely transparent, it was a way for her to get away from my dad, who was not a nice guy. He was funny, lovely, and angry. And I think that, I remember her having a retirement party, and she, like, within 3 days went back to work. Because my dad took early retirement, and she's like, nope, this is not for me. My dad traveled every week. Like, he'd leave on Tuesday, maybe come home Thursday, Friday. And I think it's what kept their marriage together, because I think that they were married over 50 years, but probably 45 too long.
So of all this craziness, my questions are you close to your sisters? And also, what do you take away from your parents? Because you're one of the most vibrant people in my life. So, and it has to come, it comes from somewhere. So whether it's like the adaptability comes from moving a lot, or what would you say you take away from your mom and dad?
Well, I think when you grow up, no matter what, you have your parents inside of you, whether you like it or not, and you have to figure that out. I mean, I have a wife who could call me Little Doyle at times, because I have Little Doyle inside of me. Doyle's my dad's name, meaning short-tempered, hot, if I get scared, I get angry, right? So it's like your parents are inside of you. And my mom, she's creative and she's compassionate and lovely and love crafts and stuff. Like, so now that they're past and everything has happened, like I tease out the great parts of them. I mean, but what they were doing when I was growing up was partying for the most part. I mean, they were just like they had their friend group and they had the Ohio State Buckeyes, whom they determined would be the focus of their, like, for a good 20, 30 years. They were huge Ohio State Buckeye fans, even when they moved to Michigan, which was one of the worst parts of my teenage years because of the rivalry that was going on at that point in time. But when you have your parents inside of you, I think what's really important, as an adult is to, certainly take the best qualities of them, but also get help for the things that you might have missed, like the neglect that I had. And I did that. That's one of the biggest things that I've done in my life that I'm most proud of is I knew when I first started to get into relationships that I had no boundaries, that I really had no, I had no modeling for a positive and good, relationship at all. And I got help, and it's to this day, I see a therapist now twice a week because, it's almost like people say, like, you seem so, as you would say, Kashia, like vibrant and healthy. Why would somebody like you need to see a therapist? It's almost like somebody who trains for, the Olympics, or if you're like, why would you train? You seem so fit. It's like, you have to keep this up, especially in the field that I'm in. I want to be able to help contain people's emotions, and I want to tolerate my own. And so that work to me became super, super, super important to me, even though I didn't know it at the time. And so that's just been a long-standing thing for me, is that I believe in my own mental health and my own mind being able to be shaped and healed more and more every day that comes by.
Mental health is not something to correct when it goes awry, but as a constant, continuous thing that you invest in yourself. I think it couldn't be more timely right now. I feel like left and right. I mean, people are struggling right now. It's been a lot for people. So, I think that is a powerful statement, that it's something that you believe in, just continuously investing in.
What were you and your sisters doing when your parents were off partying? Like, how on a macro and micro level, like, how did you know, figure it out?
I think that we didn't understand how, it's an overused term, dysfunctional our family was at the time. I can't remember really having any dinners together for the most part. I was involved in a lot of sports, and so that kind of saved me. And then I think for my sisters, my younger sister got, heavily involved in drugs. I developed a very, sort of poignant yet elongated eating disorder. My older sister, same thing. He just struggles in trying to cope. And I personally started to adopt maternal figures. I would find I would go to middle school, and I got to skip gym because I was in so many sports. And so I'd be the health room helper. And the woman who ran the health room, Mrs. Postula, I just heard she passed a couple weeks ago, but she became one one of those surrogate moms that I would just pick up. And I did it all the time. There was a person that worked with my mom, and she was probably a decade younger than my mom, but I would adopt these surrogate people, and kind of I was almost it was a joke that I was running around with my umbilical cord going are you my mom? Are you my mom? Are you my mom? It was I was just trying to plug in somewhere. And so, and honestly, it got confusing with me, because with my sexuality, I was like, am I liking these people because they're women, or am I liking these people because I have such a yearning for a maternal figure in my life? And so that all became confusing with almost every relationship that I would stumble into, because I'm like, what's going on here? Like, what is this admiration, or what are these feelings? And so those took a lot to sort of unpack and such. And so, yeah, I was basically having my umbilical cord in my hand for a lot of years, wondering what the heck was going on.
Trying to figure it out. Did your parents know what was going on with you at all? Like, did you ever talk to them about any of the struggles you might have been having with your sexuality or?
No, I mean, no, not at all. My parents were like super, super, super checked out. And in fact, when I was like brave enough, I stumbled upon, and this was well into college back then, my first girlfriend that I, really felt, I told I chose to tell my older sister, which was a mistake because she basically disowned me and like asked me not to come to the next family get together. And then so I told my mom, because I was away from this person at one time, and I was at my grandmother's at Easter or something like that. And I told my mom, because she's like, what's wrong with you? And I was like, well, Wendy and I are, more than just friends. And her response was, does Wendy know? And I'm like, oh gosh, this is, I'm like, this is not going to go well. And so then my dad, he basically disowned me for, I would say 4 years. It was like, and each year I would come to him and go, hey, and I send him a book called, Beyond Acceptance. And then years went by, and like, I sort of became like the black sheep that did well. And by the time my parents passed, or, like 10 years later, like, everything was great. It was fine. I'd have partners, long-term partners, and certainly my wife, Julie, now would come home and it was all great. But in the beginning, it was, for still a growing child, teenager, young adult, it was devastating to just not really have that parental support. And especially being in the Midwest, and being homophobic yourself, like not having any idea about what this really means, what this is. Like, is this normal? You feel so incredibly outcasted and deviant, and so many things where you just start to be your own self-perpetrator. Like, I mean, it's rough. So I got into substance abuse, I got into eating disorders, like you name it. I was going to try to get out of what I was feeling, which was so awful at the time.
How old were you, Holly, when this was going on?
Well, I struggled through my teenage years, because when you hit puberty, all of that stuff starts to kick in. But unlike today, where, at 3 years old, people are like, oh, he's like, you can pick up on, who they're going to be for the most part. This was well into my 20s, right? So I would say that in my high school years, I felt more adult-like because I had some responsibilities of caring for my parents and my mom. And then I went off to college and was by myself, and I sort of lost it for a long, long time, like 4 to 6 years. And it took me actually 6 years to get my bachelor's degree, because there was a lot of moving around. There was a lot of me trying to figure out what the heck was going on. And that was the most painful part for the most part. Yeah. It was just like, I was out on my own, and I didn't have anybody to take care of except myself. And I certainly didn't know how the start of doing that. In fact, my first job, my bachelor's degree was in nursing, and my first job, I'll never forget, my friend Beata, 25 years older than I, said something like, well, I think she said something like, take care. And I was like, if I even knew how to do that, I would. Like, she said something like so like off the cuff, but it hit me like, I don't know how to care for myself. I don't know. Like, I have to start learning, because this is going to go south fast if I don't. So, and then that's when I started to see a therapist and just kind of talk out things, and they get more into analysis and such. And, I believe you me, I'm sure it saved my life many times over.
Did you find, when you started seeing a therapist, was there some sort of like community that you plugged into, or did you find, because clearly like at that time your family wasn't really accepting in the way that you needed, did you find people to?
I did. I mean, so that I graduated from college, and it was probably, I I was in a band. It was a band that I kind of started, and those were my people. And it was probably, to this day, some of the best years of my life. And I was still getting help in seeing a therapist, but I started playing music, and this was just something that I loved so much. Like I had a full-time job, but on the weekends, like I remember I would rent the PA equipment and have it set up in my house, and everybody would come over, 6-pack of beer, and we'd rehearse, and then we started playing gigs out, and it was just so fun. And those were my friends, and I became kind of in that. But it was weird, my parents would write this. This is kind of telling. My parents would write this, that form letter at Christmas or those holidays. And unless it wasn't like that perfect thing, I'm like, because they'd ask for our input, and I was like, well, here's what I'm doing. And they would like leave it out. I'm like, what about me like playing with my band? Like, this is cool. It's like, Holly's a nurse. Isn't that great? It's like, it was just like that weird, like sort of old school, like, we just want, and then, like my older sister got divorced, and like, that's when the letter entirely stopped, because they're not going to report that. It's like, there was no humility about just being alive and having, I think my parents had a very short tolerance for their feelings. And I think that was kind of one of the things that was handed down to us. Like, we weren't able to explore the human experience of having guilt or love or hate or envy or, embarrassment or any of those things that you get to be an adult. You don't have a muscle for them, and you start making a mess of your life because you don't. And so it was one of the things that I think that we really were, as children, shortchanged, with all due respect to my lovely, fun, laughable, incredible parents.
It's so interesting. So you chose to, so your bachelor's degree was in nursing after your parents were pharmacists, and this is all like, medical fields. But then hearing you describe, at the same, you're from a family that cares for other people. You're going into a degree that cares for other people, but having kind of that trouble taking care of yourself in a holistic way. Can you talk a little bit about your experience of nursing in your first few jobs, and how you started kind of finding your way?
Yeah, so that's a great question. So for me, I was always with my parents. I kind of felt like I was the common denominator of all of the rifts that I got into, because I felt like there was more to healthcare than just, here, take this. And of course, my parents, they had stuff lying around from all of their vendors or what have you. It's like, just here, put this on your cut, or here, take Motrin, which was the branded name of the Upjohn Company's ibuprofen. And it's like, that was it. That was my healthcare. I mean, I walked around on a broken ankle I could not fit inside of a shoe. I broke it during soccer, and my parents didn't have the wherewithal. This is a true story. I'm not like embellishing this, like, to take me to the doctors. I couldn't fit into a shoe. So it was like a week and a half that I wore a couple big socks to school. And it wasn't until I got into sports and then I had x-rays, like, when did you break your ankle? And I was like, when did I break my ankle? So this is the sort of like, like, there was a point in time, like, I'll just tell a story because I'm sure people can relate. I got really into athletics, and I was doing triathlons, and I needed braces, and my dad's like, you can have a bike or braces. And I'm like, who gives that? I mean, of course I'm like, yes, I'll have a triathlon bike. Like, but who gives the choice of that? It's like, I need braces. So as an adult, I got braces. Like, I had Invisalign, like, and I pushed everything back and up and did it all by myself. When I finished my bachelor's degree, I felt the same way with my education as a nurse that I felt with my parents as a child. And I was like, there's got to be more. And then I also piled on, because I thought, well, I am the common denominator. Like, I am a miserable individual. But then there was this life-defining moment. So I'm sure I was on a mailing list from Spirit Dreams in Grand Rapids, Michigan, that was down the street. It's a store. And the catalog called the Omega Institute came to my door. And the Omega Institute is in New York. And it's got all of these like classes and such. And I was like, just reading through it. And I was like, holistic nursing, what's holistic nursing? And there was a number. So I called the number, and the executive director of the American Holistic Nursing Association picked up. Of course, this is years ago, so I'm sure that the organization was like this, like small, this big. And she talked to me for a long, long time. And 2 weeks later, I was on a plane going to Milwaukee to enter my post-grad certification courses in holistic nursing. And it changed my life. Like when I entered that first conference, it was like coming as an adult soul coming home for the first time, like realizing that you could look at things in a much more comprehensive way, that you could see ties from contributing factors to illness, that you even like mental illness, that you could, have theories and more universal terms about things. And it was just like, I just was like, it was a life-changing aha. Like that magazine coming to my door was just life-changing for me. And it was actually through the the American Holistic Nursing Association journal that I read about naturopathic medicine. And I was like, well, what the heck is this? And then that was my like sort of next natural step.
So I feel like a lot of people in our audience might never have heard about naturopathy or integrative medicine. They don't exactly know what it is. They know maybe it's a little more natural than, the traditional pop a pill medicine approach. Can you, in really simple terms, break that down for
Yeah,
our
I hope
audience?
so by this time. Docere in Latin means to teach. So this is what I've been doing. So docere is doctor in Latin. So this is what I've been doing my entire career, is just teaching about different systems of medicine. And truly there are. And, I think for the most part, in conventional allopathic medicine, that's run by our third party payer insurance companies, we're all used to it, right? We're used to going to the doctor and they tell us, do this, and we do it. And that's pretty much our healthcare. But it's very reductionistic. So mostly people in that system of medicine are reduced to either a sign, a symptom, a lab test, a diagnosis, and then there's a treatment. And these days, it's mostly a pharmaceutical agent or like a procedure, a surgery. And don't get me wrong, those things are extremely important. I think there's value in all systems of medicine, and Western allopathic reductionary medicine has saved my life. Like I was in a horrible motorcycle accident. I had a cecal volvulus 2 years ago. I've had breast cancer. We can get into that. But, those things are important. But when it comes to ailments of our modern day, so I'm talking about endocrine, disorders like hormonal imbalances, digestive disturbances, sleep, insomnia, stress. I think a more comprehensive way of looking at those things to get to the root cause, instead of like, let's say a woman is going through menopause. This is one of my big things, right? And you're like, oh, you're depressed. Here's an SSRI. It's like, no, there are so many things going on at that period that need to be understood by the caretaker and by, the practitioner and the patient in therapeutic relationship. And we need to talk about them thoroughly. And so with naturopathic medicine, we've got some principles. Identify and treat the cause. So don't just suppress symptoms. Treat the whole person. So we're not just looking at the body, we're looking at the mind, the spirit, however they want, their relationships, however we want to relate. Prevention is the cure. So just kind of looking out, it's like, look, you're in this high stress job. How is this sustainable? Doctor as teacher. So always, instead of here, take this, hopefully influence people, not with just education, but trying to facilitate understanding. So they're like, oh, so they can own it. There's a difference between, I would say, compliance, right? She told me to do this, or adherence, which is like a faithful attachment to something. Like I'm going to be asking somebody to make dietary changes, lifestyle interventions, maybe evidence-based dosage in botanical or clinical medicines, sometimes between meals, multiple times throughout the day. That's not easy medicine. Here, take this as easy medicine. So if I can say, look, we're going to get you where you want to go and where you desire to be, but it's not here, take this. You got to have some skin in the game. And so that's a system of medicine that I sort of have been I've been educated in, but I've been rolling around in for the last 2 decades, 20 years.
So this is what I have always loved about working with you, and I will like shout your name from the rooftops, because for myself as an RN who, has kind of moved out of the traditional RN space, we work together in this private concierge world where you get to practice a little bit more mindfully. And so if you could just tell everyone a little bit more about what the term health means to you, and you kind of touched on that a little bit, and maybe some myths that you hear constantly about naturopathy versus traditional medicine, and kind of break that down a little bit for us.
Yeah. So I hate to put you on the spot here, but I actually think of traditional medicine as what I do. Conventional medicine is what we're used to now.
Mhm.
Just for clarification on terms, because as you well know, Kashia, I'm so particular on these things. But traditional medicine is like, using like more plants and like traditionally that's what we did. And then, things have evolved into this sort of, you know, uh, medicine that's sort of like if we could take the money away, it's so profiteering. It's profits before people, and that's what's always gotten me sort of upset. But I think some of the myths is that it's kind of sort of woo woo, right? And or I hear alternative, and sometimes I'm like, alternative to what? And integrative. I always like to say it's integrative. It's like, because you really think things through. One of the taglines that I've had throughout my career is, and I made it up because my patients helped me. It's like, let's just think this through. Let's put the dots together and connect them. The body is a brilliant, amazing, wonderful thing. And it does have an inherent ability to heal. What we have to do if something clinically is up and there are symptoms and signs is understand what are obstacles to that body doing its job of healing itself, always wanting to come back into balance, always wanting to come back into equilibrium. So does it take a little bit of time? Does it take, sort of like putting on your sleuth hat and figuring things out? It does. Does it take remembering your endocrinology, remembering your cofactors? If you take a biochemistry class, it is like taking a nutrition class. You have to understand what are these cofactors that drive your biochemistry, how you live, like how I can tell my finger to go up right now, how I can focus my eyes, how my liver is detoxifying right now. And in conventional medical school, nutrition is like a sliver, if anything, in the curriculum. And so for me, especially working at this, high-end concierge practice with primary care docs that are caring for these people that have access to them, I have yet once, delivered a recommendation that has not have an evidence article behind it. If I wanted to use boswellia for joint pain or for Crohn's disease or for ulcerative colitis, it's like, I will show them. So this is evidence-based medicine. The problem is, I think our society is you can't patent a natural substance, right? So therefore, if it's not patentable, what can't you do with it? You can't make a whole heck of a lot of money. So I mean, I hate to shout from the rooftops or get on my soapbox, but I think that's part of the problem in truly helping people heal and having healthcare. And when you talk about health, it's interesting. I tried to look at that word up in the dictionary once because it was on a presentation that I had already named that I was going to give, but I hadn't written the presentation yet. I just wrote the title. And I was like, what does health mean? And I was so underwhelmed with, because it seemed like good or bad, like right or wrong. And I came across this word eudaimonia, like you as in euphoria or good, like are you thyroid, like it's okay. And daimonia is spirit, like just good spirit, like humans flourishing. I was so excited about that word that I actually had it tattooed on my arm, which you can't see, but it's like, and that's how I really feel. It's like, I don't care if you're 30 pounds overweight, are you healthy inside? Do you have a good spirit? How can you move around and be with your children, grandchildren? Are you where you want to be? How long do you want to live? Like, it's not these metrics that we go by as far as like reference range labs, right? It's like, oh, your cholesterol is high. Okay, well, let's think about that. But who are you as a person and how is your spirit? And that's one of the biggest drivers for the work that I do, in my opinion.
What are some things that you do in your personal life to maintain that sense of eudaimonia? Is that the word?
Eudaimonia, yeah. I think one of the biggest things and I just experienced this like a couple of weeks ago, that is really helpful, is that you only know to get in balance when you figure out you're out of balance. And I think that in nature, the tide goes out and the tide comes in, right? There's the ebb and flow of everything. There's seasons. And, if I wish I could say I wake up and I'm perfect every day, but I'm not. Like, I got a little bit too much on my plate like the other week. And it showed in my personality, it showed in my sleep, it showed in my, ability to work out. But it was something that I was able, just because of my experience, to catch quicker and then reset and say, you know what? I probably shouldn't have said yes to that. I got excited because of this, like, and go back and kind of do an autopsy about it. It's like, how did I end up here? So you learn a little bit more. And so then for the most part, my physical health is really important to me, and exercising has always been really important to me. So that's something that helps me with my stress, as, just any, sort of, it's just something that's been there. It's like, I love to move. And the other thing is staying with my therapist twice a week. That's very, very important to me. I've gotten into tapping recently, tapping solution. I'm not a great like sitter downer, right? So meditating has been one of those things that is sort of like, it sounds good when you say it really fast, but for me, so tapping, because it's actually a more kinesthetic thing, and I can like I'm doing something at the same time affirming things, like whether it's my anxiety or anything else going on. That's been something that's been really, really helpful, and I've been more consistent at in the last several years. That's been very, very helpful.
Can you break down tapping really quick for our audience? Can you just tell them?
So I guess you could pull in then, traditional Chinese medicine, so meridians, right? And there's these points, whether on the top of the head, the top of the brows, under the eyes, under the chin, and there's where you can actually say, you first, when you're tapping, kind of affirm like, hey, what's going on? Like whether your anxiety is there, you can't get to sleep or what have you. And then you move on, and it's guided, and you move on to really allowing yourself to just be there in that space and time, and be struggling with that issue. And then almost like the next sort of series of tapping is just letting it go. And so it's sort of a mind-body connection of being able to tap at these meridian points in acupuncture. You could name them, or acupressure, you could name them. And it's pretty amazing when you start, like, or I should say, when I start a tapping sequence, and I know how I feel, and then I know how I feel after just like the 11 minutes of tapping. It's rewarding enough to like, I'm going to do that again. So even if it's inexplicable, I should say, it's something that I feel like is really effective, especially for folks who struggle with that whole meditative state where you don't know what to do with your thoughts. Like, am I supposed to ignore my thoughts? Why are my thoughts here? Like, we get so confused, I think, as a whole, in like, how do we meditate? And then people throw the baby out with the bathwater. I'm like, I can't do that. Tapping, for me, just being a more kinesthetic person, has helped me to kind of take a break. So I use it a lot between the transition of coming home from work and also now driving in traffic, and then and then having my family time and my home time and such. And then I also, as Kashia said, I have hobbies that as I've grown older, are really near and dear to me. Like, I play in a band with my wife, and as well, I have a very prolific garden that I learn a lot from as well.
Yes, which I hope has made a comeback since the coyotes got to them.
Yes.
Yes. I mean, I'm one of those people that I'm not a good meditator either. I'm not a good sitter unless I'm just laying down staring at my ceiling, but that's kind of when thoughts fester. So I love the idea of having something a little bit more actionable, but still peaceful, where you can reconnect and realign mind body, because for some of us it's, there's almost like a attention deficit component of it, where like your mind's racing so much that you just need something to refocus, and the physical component can be really very, very helpful.
Yeah, I love that as an option. Like I struggle with that too. And for me, it's like, going on a walk helps. And it's like, okay, I'm going to force myself to be present by just like paying attention to what's around me, but my body's taken care of because it has this rhythm and it's just going to keep doing it. But you can't always just
All
go
of
for a
those
walk,
things are
you know?
so important, whether it's like, and I think people should just name what it is for them, you know, like whatever it is. Like, some people come home and just like, I'm going to cook. And that's what's going to transition, or what makes me feel a little bit more centered, or garden, or walk, or tap. I think there's a lot of dogma out there right now as far as sometimes the shoulds, and I think that people are really mindful enough, if they think about it, to make up their own sort of cadence of how they can relax. And certainly, if not, they can get help. But I do believe, I was listening to a podcast the other day, and it was funny because it wasn't what I thought it was going to be. It was like these really profound yoga people that were basically like, I can't stand gratitude journals. And they were like bashing gratitude journals. And it was funny in a sense because of the way that they framed it, and they couldn't keep up with it. And then I feel like people get in that trap where it's like, okay, I'm going to journal for 30 days every day about what I'm grateful for. And it's like I said, it sounds good when you say it really fast, but okay, life happens. And let's say the 6th day, you don't get it in. And then all of a sudden there's another pile on. Like, I can't even be grateful. And I think people should give themselves a break and also think about like, hey, why didn't that work? And then what does work? Really, what does work for you? Because we all are, I know we all are super grateful for even like the littlest things. But if you're like, okay, that sounds great, I'm going to heal myself by being grateful for 30 days, and it doesn't work, does it do more harm than good? And I always just like want people to tap into like what's going to work for you in your life, in your lifestyle, in your pace of how you live your life, and come up with those things, like
Checking in with yourself and like reevaluating. Yeah.
Yeah.
So, medicine, as we know, all medicine, my belief is that just like any other industry, a lot of medicine has been capitalized upon. And you kind of touched on that. And I don't want to dive too much into that, but it is true that it can be cost prohibitive. So we want to kind of hone in on some things that might reframe simple ways or, actionable ways for anyone, especially our audience, to reclaim the driver's seat, if you will, for their own health journeys, which is something you are the expert in. So
Yeah. Well, I've always said, this whole, when I was on the lecture circuit and I would go out and it's like, how many people have a primary care provider? And I'd ask people to raise their hands, and, like a good 78, 90% of the population would say yes. And I'm like, I think everybody should raise their hand, because I think you all should be primarily in charge of providing care for yourself. Can we roll in and hire and, envelop partners in that process? Absolutely. But at the end of the day, I feel like the way that our medical society has set itself up is that the person is left to the hierarchy sort of franchise of the doctor says this and I do what they say, and that there's no power left. And if you could understand how much power you have over your body and over your health, each and every one of us individually, it would change the game. And there are simple things. And I know people know out there, like their behaviors as far as, food. I mean, we could do another podcast about food because it's so much in our society, and it's much more than nourishment. It's a drug. It's celebratory. It's social. It's a numbing agent. We want to use food as medicine at a lot of times, and so, but how you nourish yourself. The water that you drink, the air that you breathe, the sleep that you get, the movement that you have, all of those things. We can make the health care, like really caring about your health, a lot easier if people would just understand that they have so much more control than they do right now. That's the big mover for me. It's just that understanding.
I feel like, especially for a younger audience, that feeling of I'll do what the doctors tell me, or I'll do what my parents have demonstrated for me. That feeling of empowerment that, like, okay, this is my body. I'm an individual and I can, set this foundation for myself. For a lot of people, it doesn't come till much later than it seems like it can. Do you see uh, patterns or problems in patients that, you know, started from things that they were doing in their adolescence? And
Absolutely. I mean, it's kind of a touchy subject, and I'm not an anti-vaxxer at all. But I think that, some of the prescribed vaccinations throughout the years, even, for HPV and such, or some of the sexually transmitted diseases, it's like there should be a little bit more thought around it, because there are consequences. And instead of just like, you're 13, you get this, let's think about this, and what are we actually trying to prevent? And then also, what are, use the least invasive methods to diagnose and treat. So are we educating about safe sex and other, sexually transmitted diseases and behaviors, et cetera? I think that information, instead of like, you're this age, you get this vaccination, let's just look at it. There's many people throughout my career where, like I said, I think vaccinations are important, but do we need to do them all in one fell swoop? Can we have this, more relaxed schedule around them and understand individuality and responses to them and such? And so I just think it's super important for people to understand that they own their own healthcare. And I think that should be a message from the very, very beginning, that, our doctors work for us, our healthcare practitioners work for us. And that's the relationship, not the other way around. And it's been so cattywampus for a long, long time that I just think that messaging needs to change, and young people especially need to be empowered. One of the things, I think it's on my very stripped down website at this point in time, but it's Dr. Holly Lucille's like number one health tip, and it's I statements. It's basically like, being able to say, my doctor recommended this for me, but I'm choosing to take it. Or, my doctor recommended this, but I'm going to think about it and do a little bit of reading. And then I'll come back to it. It's like, so many people over my career would come in and it's like, well, they told me to do this. And well, he said this. And I'm like, it's so unconscious, but it's so true that these people have given up their power to these quote unquote doctors, and just flip the script and say, he told me to take X, Y, and Z, or they told me to take X, Y, and Z, but, I'm going to think about it. And I think X is probably going to be good. I'm going to wait and see how I feel about Y and Z. And that means that you chose to take that. You are choosing what you put in your body. You're choosing that. And that is empowering all in itself. And I just want to see a lot bit more of that.
I love that too, because I mean, we do as a society, we look toward doctors as experts of the body. But I think one of the components that's missing from conventional medicine is that we should be experts of our own body, as you said. And the reality is, like, even when you go and get your labs drawn, your labs are a snapshot in time. When you walk into the doctor's office, you're walking in on that day with all of the weight of that particular day and everything that's happened to you just before and what's coming up just after on your shoulders. And so they are, our doctors, even the very best doctors, really depend on us as the patients and us as the individuals to understand and know our bodies well, because at the end of the day, whether you think you're in the driver's seat or not, you really are. And so unless, you're taking account of, this is how I've been feeling for, X amount of days, or this is, my pattern. I mean, nobody else is going to be able to say that except for you.
exactly.
Very true. And the other way around, I've had doctors at my current work, like say, introduce me just literally by email and or even just by a summary of this person, and say he's got metabolic syndrome. He needs to lose about 25 pounds. Can you help him? I'm like, sure. However, I need to understand how this person, who this person is, how they tick, what makes them tick. How do they learn? How, what do they feel around exercise? How do they feel around food? Like, certainly if you want to, me to spit out a protocol for, decreasing weight, increasing movement, and, helping metabolic syndrome, yeah, sure. But who is that going to help? It's like nobody, unless it's almost like a painter, right? An artist. Like you go up to them, just go up to them and go, paint me something now, go. Like, here's a canvas, just paint. Like, just paint. They have to have an inspiration. For me, my inspiration will always be the person in front of me, and I can't work without them. There is absolutely no protocol. I call them wake-up calls. There's no protocol in the world that can help anybody unless I have a therapeutic relationship with somebody who has skin in the game, who wants to do this with me and who wants to do that for themselves. Like, that is the secret sauce. That is a sweet spot. And I believe that across the board, we can Band-Aid people together with medicine and procedures. And here's the deal. There's no money when people are dead, right? And there's no money in wellness when people are healthy. The money is when you just get this little place where people are just keep like that. That's where the continuation is. And we're stuck in that so much. But to bust out of that and just really truly live and be healthy and happy is where I'm always going to have my passion for folks to be.
Okay, so in the spirit of proactive approaches to health and owning that, what are, if you could boil it down to 3 things, what are 3 things that you think everybody across the board should be doing? Like, whether it's taking something, eating something, drinking something, give us your 3 cents.
Yeah, I would say sleep. I abused sleep, and I was one of those I'll sleep when I die gals for a long, long time. But it truly is one of the best medicines. And so sleep hygiene, as young as you can establish it, as a habit as you can establish it, is going to be one of those things. Unfortunately, but that is definitely one. 2 is laughter. I mean, you gotta just heal with laughter. Find your folks, find your funny, find your ridiculousness and stay with it. But just laughter is extremely important, and movement. There's a lot out there. I mean, a lot more I could say, hydration, all that stuff, but movement, getting, circulation, and I'll say this in so many different ways. Even early onset, I've seen this throughout my career. There's now a new diagnosis, early onset cognitive decline. Okay, there's early onset macular degeneration. I believe it's because we're not getting circulation to the places where you need, right? Circulation gives the nutrients in the blood and the blood flow to the cells that we need. With our eyes for macular degeneration, we're not running through the jungle, moving our eyes. Everything is in front of us. People are in front of us, Zoom is in front of us, books are in front of us, our computer's in front of us. We're not exercising our eye muscles anymore. So we are having quote unquote early onset. Cognitive decline, same thing, right? We have a lot of things given to us. We don't have to think very much anymore. I almost forgot how to do math the other day. It's embarrassing. We've got to keep moving in ways that we don't even, we got to turn back. When we used to have a more natural relationship with stress, we would get home from our days or get done with our days, right? Not that everybody went out of the house. You can be a very important person, like a stay-at-home mom. And then what would we do? You'd have to go hunt and gather your food, go gather your water, start the firewood. We would burn off our catecholamines. And our catecholamines are those stress hormones that we kind of creep up during the day, perhaps. And that would help us have sleep pressure so we could get a better night's sleep. And so I think the way that we run Wired But Tired is something that movement will help with. And so movement, I think, is extremely important.
Do you have any thoughts as to whether movement at the with that anecdote of how we used to be, as animals and as, hunter gatherers, do you find that movement's better early in the morning, late in the day, or it just doesn't matter?
I think that's a very individualized thing. I have to get up and get it done, right? But relaxation and stretching and mobility at the end of the day is important for me. So it's another sort of stress reliever. But I think that question is very individualized. I know people that get off of work and can go work out. I cannot imagine that self for myself, at all. Like, if I don't get up and get her done, it's not going to happen. And I have a feeling a lot of people are like, mm-hmm. But some people, because she like you, if you get home from work and go work out, that's great. And maybe, and it's so funny. Like, I was talking to a gentleman that is running a precision medicine clinic. And when we say precision medicine, our genetics are all different. We're biochemically different. And there are those folks, that I have seen people in my practice where pretty much same presentation, whether it's uterine fibroids or what have you, and similar modalities. One person will get better, the other person languishing a little bit. And I think that DNA testing and genetic testing, now that we have more access to it, now that it's more cost effective, I think precision medicine is a fun way to actually get more answers for yourself individually. And that's what I think naturopathic medicine also offers. Like, we can have reference range labs all around. Like, I have plenty of people coming in with vitamin D levels, like one click above rickets, and your doctor's like, oh, you're fine. It's 24. And the range is 24 to 100. Is it normal? It's normal from the reference range. Is it optimal? Not from the evidence, not from what I've seen. When it drives immune, when it drives thyroid, when it drives all these other things that vitamin D does, it's not optimal. So we choose to use words like, can we get you as an individual to be the optimally best? And there's other functional tests that can do that aren't reference range. They actually have data on who you are, what your microbiome is, what your nutritional status is, that are much, much deeper involved in the individual process than just reference range labs.
Yeah, I completely agree. I mean, and for those of you who don't know, when Dr. Lucille mentions reference labs, that's like the normal values. Those are the normal standards that conventional medicine typically looks at. So when you go into your doctor, once a year, once every couple of years, and they run a test on your blood sugar, normal blood sugar should be anywhere from 60 to 100 in a normal person. And maybe that's a bad example because that's a pretty standard one. It dictates, whether you're tired, hungry, if you're feeling dizzy or weak, maybe it's because your blood sugar level is dropping. But other labs, like your thyroid levels, may fall within a normal range for the general population. However, as I mentioned before, unless we're tracking you as an individual over several years, how do we know that that's normal for you?
And also, so much of our body's processes are so dynamic, and you think about how long that needle is in your vein. It's like for a snapshot of that dynamic process. And it's during a day where what's the day versus the night and the diurnal rhythms that you have. It's like, so we can get a little bit more specific in root cause medicine. So root cause medicine means we're going to get to the root cause and cure and heal instead of suppress symptoms and just Band-Aid. And that's another little sort of linchpin about a system of medicine like naturopathic medicine.
I have kind of a more personal question for you because I've shared on our podcast, I went through thyroid cancer and had my thyroid removed and treated and everything. And part of that journey for me was, the physical journey and getting opinions and going through surgery and everything. But there was also this emotional journey because I, up to that point and still have always seen myself as a very proactively healthy person. Like, I love yoga, I love nutrition, fresh air, hiking, all the things. And then I was still a person that got cancer. And I think that kind of coming to peace with that, has been a journey. And I know you mentioned your breast cancer diagnosis. Can you talk a little bit about how that was for you? How you know, did you ever feel like you were treating it? How was that for you?
I mean, to be honest with you, I was devastated. So I found the lump myself, and it was during the pandemic. And so my gynecology appointment had been moved twice because of the pandemic. And if people can't remember, like, we were sort of on lockdown for a bit of time, right? So people weren't seeing people. And I knew I had an appointment with her 5 days later, and she rolled over the same lump, and she's like, and I said, she's like, you know what? She's like, it needs to be assessed. So the first person that I had assess it basically told me it was nothing. And this is kind of like part of the journey. And this is another kind of point that I just want to make sure that everybody hears, is that And I'm like, well, it's something. What is it? And he's like, I think it's just like trauma. And so when I got the written report, it said trauma from an ill-fitting bra. And I'm like, well, this gentleman doesn't know me very well, because if I had an ill-fitting bra on for more than 3 seconds, I certainly would not have it on long enough to create trauma in my breast, enough to like have this lump, right? So at 5 o'clock on like a very noticeable lump. So I called my gynecologist back, and I was just like, I'm not comfortable with this. And I was so happy that, and look, I was so thrilled that I left his office, and I'm like, I don't have breast cancer, which was the worry when you stumble upon a lump like that and your gynecologist confirms it. And of course, I could have stuck my head in the sand. It was like, he said I don't have breast cancer, I'm moving on with my life. Well, if I did, I probably wouldn't be here right now, because I was like, I lifted up my arm, it would dimple. Like, I just was like, I don't think this is right. And I said, I wanted a second opinion. And the second opinion is really important. And it's okay. You can smile and nod and tell your doctor, thank you. I really appreciate your recommendation. I really appreciate your input. I just need time to think about this. I might want to consult with somebody else. That is so perfectly okay to do. Somebody else, like another system of medicine, somebody else like myself, like somebody else. So I did, and we did a biopsy, and sure enough, the next day, my breast surgeon called me. She's like, you have intra and outer ductal cancer. And I mean, same thing. Like, I grow my own broccoli sprouts every day. I mean, it's like, I like, what the heck? And so it certainly was one of those things that, well, I would say it's really important, the stages. So you're kind of in shock, and I'm probably sure, Aisha, you were as well. Like, and then going through the procedures to deal with the cancer is also very, it's consuming. It consumes your emotionality. It consumes your physicality. It consumes your intellect. Like, you're going through it. I think it's later on that it's one of the worst things, where it's like, wait, what just happened? Because then you're healing from the surgery, which is another thing that isn't anything. It's a lot, right? So healing from any surgery like that. And then it's just like, wait, what happened? And then it's important, I think. So yeah, it was tough for me. I think it still is. I'm only a year out from my initial diagnosis. I'm very emphatic about, loving conventional oncology for taking care of the tumor. It's now my responsibility to understand my terrain, right? So if you think about an image of a goldfish, right, swimming around in a filthy pond, and that terrain not being good for the goldfish. And then you think about a goldfish being in like when you used to go to junior high school and put the ping pong ball in and win the goldfish at the carnival fair in clean water, and then putting that clean water bag in the filthy pond. It's like, that goldfish is now in a better terrain and so it's our responsibility, I think, to understand, like, okay, how did this cancer happen? Like, what can we do to look at root cause, even when it comes to cancer? I mean, especially breast cancer. I mean, one in 8 women at this point in time are being diagnosed every single day. So, and any other cancer. So I don't think I'm out of the weeds yet as far as my emotionality. I think sometimes it's still like, I look, those little moments you have with yourself, and you're just like, wait, what happened? You're like, holy crap. I'm still there, to be honest with you.
Yeah, I feel that tension between, because I feel like, okay, the way that I approach my life will never be the same, because that is something that I went through. However, I don't want to get stuck to it, and feel like, oh, I had cancer, therefore this, that it's something that you have to live with, but through at the same time.
Yeah, there's a certain loss of innocence, I think, to be honest with you. I mean, there is. And at the same time, I think there is a devastation. But it's also one of those things, as you said, like, that you're devastated, but you're going to live with it and get through it and be with it. We're never going to be the people that we were before, who hadn't been diagnosed with cancer. We have now been diagnosed with cancer. And the C word has always been that connotated word. It's like, but can we understand it better? Can we understand, like, what had happened? And then can we understand our pathways to more healing and health past everything we've been through? I think are important questions.
I love that. And I think that could also be applied to a lot of different situations. I mean, in when you're thinking about health, I mean, I'm listening to both of you talk about your journeys with this, and there's a lot that resonates with me and what I went through with my miscarriage and the subsequent procedures that I had to have. It's this total lack and loss of control, and that, you know, it doesn't matter how well you take care of your body, these things happen, and how you get through them and how you sit with that and, see yourself through these like waves of emotions and, anxiety and tension and grief. It can be done, but there's certainly, peaks and valleys and thankfully a lot of resources.
Yeah, I feel like the only healthy way that I've found to really like understand it is that it was just profoundly humanizing that, this is something that takes me down to that base level that other people have had this too, and other things. And it doesn't matter how many good habits or practices or whatever you put into your life, you should do all those things. But at the end of the day, like we are human, and this is something that at a really deep level can connect me to other people. And together we can seek to make that experience better for someone else.
I love that. My company's called Humility Inc. And it's like, you're going through the process of creating an organization. I was like, what should it be called? I'm like, humility is probably one of the most fantastic characteristics that I enjoy in people. And I think this is helpful, in helping to understand it and then also come to terms with it, but at the same time, make it personal and real and help other people. It's like, for me, if I can't help other people from going through something like that, it is for naught. Like, that is like, I'm looking for avenues everywhere to make a difference in this area. Especially, I think breast cancer, like 1 in 8 women, is just, there's something going on there that we have not put our finger on yet that we need to, for sure.
Yeah, absolutely. And I think women's health is, it is its own specialty now, but from your perspective, sort of going back to that question I had earlier, are there things, having lived in your body and having the wealth of knowledge that you do, are there things that you could impart to some of our young women specifically about, you know, how they should take ownership of their own care, or some misconceptions that you may have heard that you'd like to break down?
I mean, I think Aisha kind of hit it on the head. It's like thinking that you're omnipotent just because you're young and in your 20s and feeling fine and feeling great, until something, like your back up is against the wall. So not taking that for granted, to always paying attention, not thinking that you can like live on Red Bulls and, during the day and alcohol at night, medicating your sleep wake cycle, I think is a big one that I see young kids getting into sometimes. And just, thinking about prevention and longevity and sustainability. And, if there's a desire to live past 40, 50, 60, have a healthy marriage, have a healthy children, perhaps, if you wish, and grandchildren, and looking beyond the instant moment of gratification that we all go through, go for and to so much, is really important. So prevention is the cure. Always thinking about your cells and thinking about your body and treating it well, saying thank you, and not abusing it. Because I think that from emotional reasons, for psychological reasons, we can be our own best perpetrators, and that's something that physically our bodies take on, and it can definitely contribute to problems down the road. So all of those things, just being more mindful as we grow up, for
I
sure.
like so distinctly remember, when you're in your like late teens, early 20s, that feeling of just being like, I can do whatever I want and look like my body looks great. I have energy. I can sleep 4 hours a night. I can, eat frozen yogurt for dinner, like whatever it was. But that short-sightedness though, I feel like in the back of my mind somewhere, I knew that like this isn't sustainable or healthy, some of these thoughts, but you just kind of put, when you're young, I feel like that power of your mind to just push things aside to just have your right now is so, so strong. I actually feel like it was stronger then than, it's been since then that that in the moment feeling when you're so young is powerful. But
I mean, enjoy it. I mean, enjoy that innocence, but stay mindful at the same time, I would say, if you can do it.
Just know that it's going to hit different at 30 and 40 and 50.
Yes.
Okay, well, as much as we want to keep you forever, and I'm lucky that I do, I get to keep you for forever as my friend. But we would love to transition into something fun and just lighthearted that we like to bookend some of our interviews with, and that is our round of Fast Five questions. So, are you ready?
Let's go.
Okay. Your favorite health or wellness product right now?
Curcumin.
Why?
So turmeric. So curcumin is the active ingredient in turmeric. And so here's the deal, and here's why. Like, let's say you want to inhibit COX-2 inhibitor, right, which is an inflammatory enzyme. A COX-2 inhibitor will do one thing. It will inhibit COX-2. Curcumin, which is, it's a slang term for, there's a family of curcuminoids. There's dimethoxycurcumin, there's dimethoxycurcumin, there's curcumin. So those are the active medicinal ingredients in turmeric, right? That horizontal tuber. It has the ability to touch on over 100 molecular sort of targets. So angiogenesis, anti-inflammatory, anti-cancer properties. Literally, I can't think of a better thing for anybody to be on if they just want to be healthy. So that is my answer. Next.
Your favorite place in the world to go camping?
I would have to say Catalina Island.
Your go-to karaoke song?
It would have to be Pure League Amy. Amy, what you want to do? And nobody in your audience will understand that song, so they're going to have to Spotify it.
I guess this isn't as lighthearted as the others, but what is the most damaging myth or trend in female health that you're seeing right now?
I'll tell you. I'll tell you, and it happened to me today. I was talking to a doctor, a very esteemed doctor whom I love, and he asked me if I was vaccinated or not, and I had to say no because I said my oncologist doesn't want me to right now because I said, that's what I said, and he said, the doctor I was talking to is referred to as a he. He said, well, why doesn't he? And he automatically thought that my doctor, because I said doctor, was a he. And I get it. But I said, well, she thinks, and he's like, oh my God, I'm so sorry. I'm like, nope, I do it myself. I think that we are so programmed into this patriarchal society. And I am not for being out of balance. I'm being for imbalance. But I think we've been so out of balance with, there's even things where oh man, right? We say things like that, or I love you, man, or hey guys, I do. So this, I honestly feel like this is I feel like there's these little micro oppressions that happen with just females. And I'm not advocating for a whole feminist movement where I'm advocating for balance, the yin and the yang, because I think that's where the sweet spot is. And I think that we've been living so oppressed in this patriarchal society for so long, and we do it to ourselves. I think I'll also say that the other myth is that menopause is this place where life halts and sexuality halts, and that you start perpetrating yourself or menopausal moments or my menopausal middle, or start getting down on yourself, where really it's one of the most profound transitions you can actually go through, right? So I think those two things are the things that get my attention the most. And they're very subtle, but I think they're very, very important. And I have to catch myself too. There's a lot of times I remember being in practice, where I was seeing 7, 8, 10 patients a day, and people would come in and talk about their doctors, and I would say just he, and it's a habit of all of ours, and we just need to raise our consciousness around it. I think those pronouns are extremely important these days, but mostly also for getting us back to a female and male balance from the energy perspective of this world surviving a little bit better.
Absolutely. Okay, what thing or things are you most looking forward to in the next 6 months?
So I think more time behind my diagnosis. I think the tincture of time is really healing for people. So that's something. I'm looking forward to, I think, leaving this pandemic and hopefully realizing a little bit of how we came through the Spanish flu and having the roaring 20s, where there's been so much division over so many things, where we can maybe just like hold hands and dance in the streets together and really come together as a nation, as a world. I'm looking forward to more of that, and I want to do everything that I can to contribute to that. I have felt so sad about how many divisive, how much divisiveness has gone on for whatever reason. And then the miscommunications and like the digging in that people do, and that we're all humans. And I want to go back to that theory that we're all connected, and we just really need to wrap our minds around that, and our hearts around that, and our arms around that. And so, to be honest with you, if that could happen the next 6 months, like that's what I would look forward to the most.
Where can people find you, get in touch with you, learn from you? What's the best place to go?
I think LinkedIn probably would be the best. Maybe send me a note through there. I think I'm sort of rejiggering some of my online presence. But also if anybody has a question or needs me immediately, I can give you my email address, which is just Dr. Holly at drhollylucille.com, and I'm pretty darn responsive to that. So anything I can do to help, I would love to. Except I can't give medical advice to anybody who's not a registered patient of mine. It's just against the law, so I would say that too.
And you have a podcast, right?
I have a podcast called Mindful Medicine. It drops, I think, every Tuesday on iTunes, Radio MD, iHeartRadio, all that stuff.
Amazing. Well, we love you. This was so much fun.
I love you. Thank you so much for having me. And thank you for the work that you are doing. There's always help and community out there. And you two are definitely spearheading that. So I so appreciate it.
Thank you so much.
We have one final question that we like to end with, if we can. And I would just love to know the answer. If you were to look back on your teen self, what's one attribute that you had, but that you didn't see the value in then, that you appreciate so much more now that you're an adult?
Being able to turn inward and know how much I love myself, and that I deserve that love, and, could take care of myself better, and just really care for myself better. That would be the big thing. It's just like I love you, little Holly. You're a superstar. You're a rock star. You're funny and loving, and certainly didn't mean any harm out there. And I would have said that to my little self over and over and over again. Now I'm crying, so I'm gonna go.
Yeah, well, thank you so much for your time. We so appreciate it.
And that's our show. If you liked what you heard today, please like, subscribe to, follow, and share Meet Bridget with your circle. The best way to help our work here is to rate and review our podcast. We're listening and constantly working to build something helpful for you. Catch you next time.
Did you have an awesome time? Did you drink awesome shooters and listen to awesome music and then just sit around and soak up each other's awesomeness?